New York City has taken a decisive step in its battle against the detrimental effects of social media on youth mental health. The city is suing several major social media networks, including TikTok, Instagram, Facebook, Snapchat, and YouTube, alleging that their platform designs exploit young users' mental health, resulting in significant financial costs to the city's health programs and services. According to the lawsuit, these platforms have contributed to an increase in mental health issues among young people, including depression and suicidal thoughts. The burden imposed by these issues is substantial, impacting not only individuals but also cities, school districts, and public hospital systems that provide mental health services to youth. This legal action comes in the wake of congressional hearings where social media executives faced tough questions about the impact of their platforms on younger users, particularly teenage girls. Concerns have been raised about how these platforms may direct users to harmful content, negatively affecting their mental health and body image. While some families have already filed lawsuits against social media companies over their alleged impact on children's mental health, New York City's lawsuit represents a significant escalation. Mayor Eric Adams emphasized the importance of this action, likening it to previous public health campaigns against tobacco and guns. The city is seeking both monetary damages and equitable relief to fund prevention education and mental health treatment. Additionally, New York City has unveiled a social media action plan outlining strategies to hold social media companies accountable, provide education and support to young people and families, and conduct research into the long-term effects of social media on youth. Social media companies, however, have defended their platforms, asserting that they have implemented various tools and features to support young users and their parents. Snapchat, for example, emphasized its focus on facilitating communication among close friends, while Meta highlighted its extensive efforts to ensure the safety and support of young people online. Despite these assurances, Mayor Adams remains deeply concerned about the harmful and addictive nature of social media features, which he believes are negatively impacting the lives of young people. He lamented the shift away from real-world interactions and outdoor activities, with many young people becoming increasingly absorbed in screens and exposed to content that fosters insecurity and depression. The decision to sue these companies represents a bold and necessary step to address a pressing public health issue. However, legal challenges remain, particularly in the United States, where 230 of the Communications Decency Act shields tech companies from liability for user-generated content. In contrast, the European Union's Digital Service Act provides a framework for holding companies accountable for harmful content, offering a potential model for future regulation. As the legal battle unfolds, it raises important questions about the responsibilities of social media platforms in safeguarding the mental well-being of their users and the role of governments in regulating these powerful entities. In conclusion, New York City's lawsuit against social media companies underscores the urgent need to address the negative impact of social media on youth mental health. While legal battles may be challenging, they represent a crucial step towards holding these platforms accountable and protecting the well-being of future generations.